Members of the cabinet have been assigned to assist local governments in Metro Manila and nearby provinces in their fight against COVID-19. Presidential Communications Secretary Martin Andanar has been tasked to monitor the COVID response in Laguna. Currently, the province is under the modified ECQ. Secretary Andanar now joins us live via Zoom. Maayong buntag, Secretary. Thank you for speaking to us. Now, you met with Laguna Governor Ramil Hernandez last Friday and you visited the province over the weekend. What were you able to discuss with him?
Maayong buntag po, Ria. Good morning to everyone who is watching right now. From my meeting with Governor Hernandez, the province has been steadfast really in immediately responding to the COVID-19 threat, but unfortunately it has still risen to become a COVID-19 hotspot. The province right now is one of the leading local government units nationwide in contact tracing with a ratio of 1 to 12, and this is something that we can maximize to manage the transmission rate. The government did mention to me that 70% of those positive in these 5 top cities and municipalities with COVID-19 cases have 70% of those who are positive coming from the industry. So it's one area that we have to work on. We have to focus on these 5 and the industries as well. Apparently, there's a problem, Ria, with the industries and the barangay communicating to each other. There's also a problem in the coordination, and the governor asked the assistance of the NTF and the PCOO to help set up a hotline between these two, the industries and the barangays.
All right, as you mentioned, Laguna is a bit of a hot spot. As of August 15, the province has 2,413 active cases. So you mentioned that there are certain communication gaps between industries and government. What can be done to seal those gaps and make communication more efficient in order to contain the spread of the virus?
Thank you. That's a good question. The important task is to be able to talk to all of these 21 industrial zones. These 21 industrial zones have at least more than 2,400 companies. And we have to set up a mechanism wherein the industrial zones can contact one BPO or one hotline, wherein this center would then coordinate with the barangays. Because what is basically happening is if one is positive in a certain company and the HR company calls the barangay, sometimes the barangay would say, we cannot take this positive patient. Now, there needs to be a strong political will coming from the LGU, and also the national government should be able to provide more isolation units for the barangays in this case. So this is just one of the problems that they are facing right now. So it is very important that we set up that mechanism and this hotline to coordinate. Now, I've talked to several people. We have talked to the civil society, the NGOs, private companies. We're setting up a BPO. We are also setting up an application. We're talking to this company today. We have been coordinating with the Eagles Association all over Laguna. I've visited at least two areas in Laguna. One is Cabuyao, which is a hotspot, and another one is a non-hotspot, San Pablo, and trying to compare the good practices in these areas.
All right, so Secretary, you're saying there aren't enough isolation centers in Laguna right now?
Well, the ward beds are already at 80.6 utilization. So meaning this is already critical in terms of the ward beds that are ready for patients. Now, if I could just, so if I can just get the data in front of me. We are looking at a Laguna COVID situation data. We do have, hold on for a second. Okay, here it is. 80% utilization above warning zone for the ward beds, as I mentioned earlier. The ICU beds, severe and critical cases, severe cases isolation beds, mechanical ventilators, non-ICU beds for non-COVID, ICU for at least 40% to 69% utilization. And then the mechanical ventilators for non-COVID, 27.5 utilization rate. Now, depending on the area in Laguna, depending on the municipality or the city, some cities would have enough. Some cities would have just right. Mm-hmm. So, if the patient is already positive, and we're looking at bringing that patient to a hospital, and we're talking about wards, then definitely we are at a critical stage with only with 80% utilization rate.
All right, Secretary, everyone is waiting with bated breath because they know that President Duterte is expected to announce the new quarantine classification tonight. Do you think Laguna is ready to go back to GCQ? And what are your thoughts also on Metro Manila?
Well, that's been a point of contention last week during the IATF. We are waiting for the meeting today to transpire again for different senior IATF members to discuss, thresh out some issues in Metro Manila and in the different regions surrounding Metro Manila. It will really depend on what we will talk about this morning, Ria. And I know that everybody wants to get out of this MECQ because it's really been a burden to everybody, both in the economy and also in the health sector. Of course, if you ask the doctors and if you ask the medical practitioners, the experts, they would probably say that we still need to ensure that this disease, this virus, does not spread any further. But if you ask the business owners and the employees, you'll also understand that jobs are not only at risk, but also businesses losing capital and losing the ability to be more resilient.
That's right. Thank you so much for your time this morning. We do appreciate it. Presidential Communications Secretary Martin Andanar.